Chapter 59, Iron Metabolism and Genetics. And this is specific training for the iron sensor, which is for the disease called hemochromatosis. Alright, and here I need to differentiate between men and women. Let's first look at the disease from men. And this is how it is happening in hospitals today. It's a very slow disease. You have a genetic variation that causes your body to absorb too much iron from food. And iron cannot naturally be removed from the body. So what happens with these genetic variations, that over the years the amount of iron increases and increases. It's stored in the blood, it starts to store itself in tissues and organs and starts to damage the body. So it's kind of like an iron intoxication. So it begins with joint pain, susceptibility to infection, so the immune system gets weaker, you develop diabetes, and it can go as far as cirrhosis of the liver, complete liver damage, and in the end it is fatal. And doctors that know about this disease would then at some point do a genetic test to find out, are these elevated levels of iron that we've seen, are they to do with eating too much iron, alcoholism, that's also a cause, or is it really hemochromatosis? And once the genetic test is done, it confirms the disease. However, 76% of all cases are misdiagnosed. So they recognize, oh, it's diabetes, they treat it, and the cause that actually has caused diabetes becomes worse and worse. So it's a big problem that's misdiagnosed. It's not so easy to diagnose. But this doctor knows about genetics. He did the genetic test, he got the confirmation, and then he begins treatment. And that is the bloodletting therapy. It's not just something from the Middle Ages, it still has some validity. Bloodletting does the following. You take half a liter of blood from your body, and blood contains hemoglobin. That's the red stuff that carries oxygen through the body. And hemoglobin needs iron to be formed. So when you remove half a liter of blood, the body begins to produce new blood. And that will use up some of the iron. So if you do that every 2 weeks, you can rapidly reduce the amount of iron in the body. And then you continue doing this for the rest of your life, but in longer distances. So the amount decreases, and then you can keep it in a normal range by doing regular bloodletting therapy. The problem is that the diseases that have already developed will remain. So cirrhosis of the liver, diabetes, and so on. So really what this genetic test does in this way, you first develop the disease, you use it for diagnosis, is damage control. Now, the concept of preventive genetic testing is the following, and this is what we're doing. You can do this genetic test, it's exactly the same genetic test that hospitals use to diagnose the disease, but you can do it before it's even possible to recognize that there are elevated iron levels in the blood. So you do it at a preventive stage. You do the genetic test and you find out you have the genetic variations for this disease. And that's the beauty of it, you do specific prevention. And this is not don't smoke and eat healthy like everybody knows they should do, but this specific prevention is 4 to 6 blood donations per year. It's the same as bloodletting therapy, but it removes blood, your body produces new blood and uses up iron. And through this, that's the most important part, you do help, of course, people. You of course help people, but you stay healthy. So using the exact same genetic test, identifying exactly the same genetic variations, you can remain healthy rather than doing damage control. And in women it's different because they might have the same genetic variations, but they have a long time of menstruation. And menstruation is just like bloodletting therapy. They lose a lot of blood. That's why some women even have iron deficiency. So before menopause, they usually don't have elevated iron levels. And only when they enter menopause, then these diseases start to develop, because then they're losing the protective effect of menstruation. So it is less common in women. It happens to develop later in life for women, and it's more critical for men. All right, now let's look at the gene. The gene that is responsible for this type of hemochromatosis is the HFE gene. And the most severe mutation is the C2H2Y mutation. And there are two others, the H63D and S65C mutation. So these three are the relevant ones. They're quite common and they cause a huge proportion of all cases. Now, every person has two copies of this gene, one from his father, one from his mother. In case you want to know more about this concept, check out the training for how genes are inherited. Now, a person has two of these genes, so it's possible that you might just have one copy of this mutation on this gene and the same mutation on the other gene. And this is what we would call a homozygous mutant. Again, check out the training for this, the training for general genetics and the training for simple disease risk statistics. So a homozygous mutant means the same mutation on both genes. And this is responsible, exactly this combination is responsible for most of the cases of hemochromatosis, the most severe type. Without treatment, you have an approximately 50% probability of developing the disease. In men, it's slightly less in women. So half of the people that have this will develop hemochromatosis. And around 1 in 200 people has this genetic variation. If only one of the two genes has this mutation, we call them heterozygous. And it is an almost completely recessive disorder. Again, if you don't know the word, please do check the training for disease risk statistics. So one of the two genes is broken, so to speak. It doesn't do its function, and the other one is working normally. This usually does not cause disease, and around 1 in 10 people will have slightly elevated iron levels, which are already above the normal range, but usually not in a level where it becomes a disease. So they are heterozygous at not increased risk. Same goes here, that's also heterozygous for a different mutation. That's heterozygous for another mutation. And then there are so-called compound heterozygotes. It's kind of like a homozygous mutant, but it's two different mutations. So you have one mutation here and one mutation here. Both genes are broken, don't do the function, and again you have a high risk of developing the disease. So it might be 2 times the same mutation or 2 different mutations that are causing a disease risk. And if you just have one mutation, you have a low risk of disease. And this here is the science behind it. Again, if you don't know what this means, do watch the training for the simple disease risk statistics. 91% have no increased risk of hemochromatosis because for this mutation they have the wild type genotype, so they don't have this mutation. 8% have one mutation and 1% have 2 mutations, slightly less than 1% actually. This is the next mutation. 64% don't have it, 35% have 1, and 1% have 2. And this is the last mutation, so 98% don't have it either. And as I said, you will get this sheet of paper that will explain the prevention. It either might be, don't worry, no increased risk, or it might be regularly measure iron levels, which the customer will be able to ask you about. He or she should donate blood 5 to 6 times per year to keep it in the normal range. This blood is completely fine for people not suffering from hemochromatosis. There's no danger about it. And they should avoid or reduce the amount of alcohol because alcohol increases the amount of iron, and they should not take their dietary supplements that contain a lot of iron. One could also counsel them not to eat too much red meat because it contains a lot of iron. However, that can also be compensated with more blood donations. So as long as the iron levels are in the normal range, I would not say that they should definitely avoid red meat. And this prevention is extremely effective. So really, if they have an increased risk and they follow these guidelines, the disease risk is very, very low. That's the end of chapter 59 about iron metabolism and genetics as specific training for the iron sensor.